Certainly the most common of all New Year's resolutions is losing weight. But beyond diet and exercise, both important things, there are some simple things you can do on top of that to lose those extra pounds. Dr. Steve Jepson is here with 3 less commonly known but relatively easy methods to help you achieve your goal of less fat in 2011. I imagine as patients and clients come into your office, you hear this request a lot. I want to shake the fat.
Well, and this is a big thing at this time of year. You just had your segment just a few minutes ago about that. But I want to talk about some unique ways to approach it. And like you pointed out, still got to cut the calories, still got to cut some stuff out of your diet, still got to exercise. But these are ways to kind of help you along on your goals.
The first one, kind of a buzz approach, a buzz topic really right now, detoxify and cleanse. And you have a system you really like.
Yeah, we have one in our office called the Malee system. They're actually a local Utah company here. But think of cleansing. You go in get your car, the oil change from time to time. You get the malware taken off your computer from time to time to help your car and your computer work better. Have to do the same thing for your body. Your body's obviously a much more complicated machine than either of those things. But you've got to do things to help the cells work better and the metabolic system to work better. So a cleanse is just all about that. You detoxify, you take some things out of your diet temporarily. In this system, you eat vegan for a couple of days, and then for 3 days you take some supplements and you drink a lemon maple syrup combination. And that combination just kind of helps get toxins out of your body that you don't want, gets waste out of your body that's blocking your body from doing the things that it needs to do, and then consequently your metabolism works a lot better, and it's a lot easier for you to lose those pounds as you're making those changes that you're making at this time of year.
So ideally you do a detox or a cleanse before you start a weight loss program. How often do you do it?
Perfect. And then you can do it, you can do it several times a year, maybe 2 times a year, maybe 3 times a year, just to keep things going along. But it's important, you'll lose a couple of pounds after doing this just from the cleanse alone, but those pounds aren't going to stay away if you don't make those changes after the cleanse in your diet to lead a more healthier lifestyle.
You've got to maintain it.
Yeah, and people can look on our website or call our office, and our staff is well tuned in terms of guiding people through this process.
You point out sleep plays a big factor in how your body handles weight and even shakes weight.
This is something that's really interesting, but they've shown that people that sleep less than 7 hours of sleep a night gain weight. There's a hormone called ghrelin that you release if you don't get enough sleep, and then that makes you hungrier the next day and you tend to eat more. If you get between 7 and 8.5 hours of sleep a night, you release a hormone called leptin, and that leptin suppresses your appetite and you're not as hungry the next day. So people that are dieting and choosing to only sleep 5 or 6 hours a night are kind of sabotaging what they're doing from a dieting standpoint, because those hormones will tell them the next day you need to eat more.
So get those Z's.
So get those Z's, and I think a really common cause of insomnia that a lot of people don't know about is hormone deficiency. They'll go to their doctor. Their doctors are just trained to hand them a sleeping pill like Ambien or something like that. It's not necessarily the answer. If you have a progesterone deficiency, which is common in women after the age of 35, you will not sleep as well. It's easy to identify, easy to fix. Sleep better, you'll lose weight.
A relatively new procedure, freezing away that hard to get rid of fat, a procedure you offer at your office.
Right. We've had our cool sculpting procedure now for about 4 months, and we're really excited about the results that we've seen. The patients that we've treated are ecstatic about the results they've seen. This is not weight loss. This is a way to get rid of areas of fat that won't go away no matter what else you do.
How does it work?
So it actually, and we'll show, well, there's a little applicator that you put on a bulge of fat, and the freezing technology then freezes that fat. Your fat's much more sensitive to cold than any of your other tissues. Your body recognizes that fat as being damaged and just then slowly breaks it down over a 3-month period of time. It's great for the lower abdomen, great for the love handles, and it's really been very effective. We're happy about it. Oh, here's a little graphic that shows what happens after the fat's frozen. Your body, those cells go in and destroy that damaged fat, and then over time that fat just kind of goes down and disappears, and it's really a neat procedure. It comes out of Harvard. We've been very happy to have it. There's only a few of these across the country now, but now that it's been FDA approved, we're seeing more and more. But we've just had a lot of people that have come in and done it and been really excited. But again, to stress, not a substitute for weight loss, not a substitute for exercise, just a great way to get rid of fat that's not going away no matter what you do.
To help you along that process. Steve, thank you so much. Dr. Jepson and staff can help answer any of your questions about any of these methods and procedures we've talked about. His office is located in Murray. You can visit his website, udmpc.com, for more information. All right, coming up next, the ultimate reuse recycle project. Eco-friendly shopping bags turned child's book bag. A local crafter whips up some DIY designs.